After asking the patient why they came in today, the patient answered, "For my diabetes." Upon him answering this question, I started discussing the pathophysiology of diabetes. In doing so, I showed him a short video. And here is the video.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Pre-diabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Pre-diabetes may or may not progress to diabetes. In food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is the hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake. Type 1 diabetes. Beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. Type 2 diabetes. The pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
After discussing this information with the patient, I continue by doing the physical exam. Alright, today we're going to do a head-to-toe assessment. Alright, so I'm going to wash my hands. Alright. Hello, my name's Christina, and what is your name and date of birth?
Joey Bone, 01/31/66.
Okay, I'm going to check your wristband. Alright. This is our assistant, Merlin. Go sit down. Go sit down, please. Come on. Good boy. Alright, wash our hands. Put on our gloves. Okay, so do you know what a head-to-toe assessment is?
No, ma'am.
Okay, we're just gonna check all your neuro and physical, coordination, and how your muscles are doing, and your vessels. Alright. First, we're gonna check your head, make sure there's no lumps and bumps all over your head. Good. Nothing hurts up there, right?
No, ma'am.
Okay. Now we're gonna check your eyes. Make sure that they're, what we call pearl. Okay? Alright. Now follow the light. Good. Alright, next we're gonna check your ears. What's that? Other ear? Okay. Now, if you'll take your mask out, I'm gonna check your mouth. Okay, do you open your mouth? Okay, everything looks good. You put your mask back on. Alright. And now we're gonna check your muscles in your arms and hands. You'll raise your arm for me. As you can go. Okay, you lay that one down. Now you do your other one for me, please. And lay that one down. I'm gonna check your capillary refill. Okay, those look good. Great. Now we're gonna check your senses. So if you'll close your eyes, and when I touch one of your fingers, just tell me which one it is, okay?
Pointer finger, right hand. Pinky, right hand. Ring finger, left hand. Thumb, left hand.
Alright, great. Alright, now we're gonna listen to your chest and check your lungs. Bill, take a couple of deep breaths for me. Again. Again. Okay. And can you sit up for me? I'm gonna check your arms and back. Okay, can you lean up? Alright, take a deep breath. Okay. Okay. Okay, if you'll lay back down. Come here, baby. Come on. Come on, baby. Come on, baby. Come on, baby. Come on. Come on. Alright, good boy. Stay right there. Alright. Now we're gonna check your abdomen to make sure there's nothing wrong in your gastro. I'm gonna palpate your stomach. You tell me if anything hurts.
No.
your senses. So if you close your eyes and tell me which one I touch.
Right foot, big toe. Right foot next to the pinky toe. Left foot, 2 toes over from the big toe. Left foot, pinky.
Okay. Alright. Put your socks back on, please. Alright. Now we're gonna check your strength in your legs. Good. Push the gas pedal. Good. Alright, push the gas pedal. Good. Alright. Now bend your knees. Alright, push. Okay, bend your knee. Push. Okay. Alright. I think we got everything on the assessment. If you want to sit up, we're going to do some teach back. So, I asked you a couple of questions, and then you'll just tell me what you learned. Okay, so you're a diabetic. So as a diabetic, there's a special diet. So do you know what that diet is?
No.
Okay, diabetic diet is low carb diet. And try to keep you lower on the carbs so that we can keep your sugar down. Because diabetics need insulin to regulate their sugar. So for you, then you would need more, less carbs as bread, sugar, green snacks and stuff like that. So you would eat more fruits and vegetables in the place of it. So when we talk about this, do you understand what diet you need to be on now?
Yes.
Okay, can you tell me what diet you need to be on now?
Fruits, less carbs, less breads,
Okay, do you know
less
why?
sugars. Yes, because my sugar count is too high.
Okay, and so you know how to do it now.
Yes.
So when you get home, you know how to prepare meals better now to
Yes.
compensate for your
Check the
diabetes.
labels to see what's in them.
Very good. Okay, well that completes our assessment. The physical assessment shows that the patient has no lower limb diabetic ulcers and no diabetic retinopathy at this time. So after the physical exam, the patient received a blood sugar test, A1C, and a quick check on their blood pressure. Next, we discussed a diabetic diet. While discussing a diabetic diet, I showed the patient this pamphlet. As you can see, it shows the different starches, fruits, milk, carbs, vegetables, meats, and it also tells them how to use the nutritional placemat. So, in this nutritional placemat, you want to, 1, develop an individualized plan with your registered dietitian or nurse physician or health educator. Like I said, this would be for diabetics. So, write your meal plan targets in the space below the food pictures. So they would write their target and have which one they would have for each one. When your meal is completed, simply wipe off the laminated nutrition placemat with a tissue. Use the nutrition placemat to help follow healthy nutrition guidelines and portion control. The food pictures will help you visualize well-balanced meals. So for a diabetic diet, you would only have one of the carbs per meal. So you don't want to have a fruit with a carb. And you want to have more fruits and vegetables than carbs at all times. If you're a type 1 diabetic, then you might have to have a carb instead of a fruit or vegetables because your blood sugar is too low. Next, we discuss the types of medications, and the uses. In this pamphlet, we discuss the effect on the body weight that the diabetes has and the diabetic medication has. So insulin, sulfonylureas, and meglitinides cause gain weight, and metformin, GLP-1, and SGLT2 tend to cause weight loss. The route of administration for the oral drugs is metformin, sulfonylureas, meglitinides, oral GLP-1 agonists, and DPP-4 inhibitors, and SGLT2 inhibitors. The ones that must be injected are insulin and GLP-1 agonists. Their place in therapy. Treatment for type 1 diabetes is usually insulin. The treatment for type 2 diabetes is insulin, metformin, sulfonylureas, meglitinides, GLP-1, DPP-4, and SGLT2 inhibitors. And this wraps up our assessment for our diabetic patient.